We hear the warning signs all the time. Eat healthy, avoid tobacco use, and get plenty of exercise. But our next guest has some new information that may give you the push that you need to adhere to have a healthy lifestyle.
Dr. Andrea Deneen is with First Coast Cardiovascular Institute, where the team is working to prevent and treat cardiovascular disease. Dr. Deneen, thanks so much for being here.
You're welcome.
So listen, how well are Americans doing across the board when it comes to prevention of heart disease?
Not well at all. We are doing a pretty good job of treating right now. So we know that a whole lot less people overall are dying from cardiovascular disease. We're doing a good job of identifying them and treating them with procedures and medication, but there's still a huge volume of people out there who have disease and a huge number of events occurring. And when I say events, I'm talking about heart attacks, strokes, issues related to vascular disease with amputations. And those are the ones that we want to try to address.
Sure, yeah.
Are there studies right now that are showing that cardiovascular disease is actually increasing?
Well, according to the American Heart Association, from 1999 to 2009, we were able to decrease the mortality rate by over 30% from cardiovascular disease. However, we do know that in 2009, based on that data as well, that there was still 1 out of 3 Americans dying from cardiovascular disease, which amounted to about 1 person every 40 seconds.
Oh, wow.
Also, in the age range of 35 to 54-year-olds, we're not seeing a decrease in mortality rates. And for women in those age ranges, we're actually seeing an increase in the amount of women dying.
Yeah. What I think was really one of the most important things that we can talk about here today are the risk factors. You know, just because people at home, if they find themselves doing certain things, I mean, they're at an increased risk for getting cardiovascular disease. But you say that there's 2 types: the things you control and things you can't control.
That's
so
right.
much.
That's right. So the ones that we have no control over are gender, our age, and genetics, our family history. So when we talk about gender and age, basically a man over the age of 55 is at higher risk and a woman over the age of 65 is at higher risk. When we start to talk about genetics, we're really worried about early family history. So that would be a first-degree relative, meaning a mother, father, brother, or sister who had some sort of event or was diagnosed with disease for a man under the age of 55 and for a woman under the age of 65.
And then there's the things you can't, or you can control,
or can have an impact.
Yeah.
And that would be high blood pressure, diabetes, tobacco use, abnormal cholesterol values, obesity, your weight, and activity level.
Now, if you have family history, like you said, your father, mother, brother, sister, or whatever, that's had that, should we start looking earlier and not wait until 45, 35, or later?
Of course. Everybody should know what their risks are and know where they're supposed to be. So if there's a family history, definitely check out the rest of the risk factors and start to get evaluated early on.
Yeah, and obviously some of the things that we can change, like you were talking about the weight or the smoking. I mean, if you find that, you know, you're checking a lot of those boxes as for things that you can control, you should be making a change ASAP.
Most definitely.
Yeah.
We have medications that we can use to treat these things, but medications have side effects. And so I think it's empowering to know that we can actually do things ourselves with lifestyle changes and really make a difference. So first and foremost, I always recommend get rid of nicotine, tobacco products, and tobacco exposure. We're seeing a trend in terms of younger and younger patients coming in with events. We're seeing 20 and 30-year-olds come in, and in the past, when I was in training, if someone came in their 20s and 30s to the emergency department, we didn't have to worry about chest pain being from heart disease. Now, not only are they coming in, but they're having life-threatening heart attacks. And so what I tell people is that I have yet to see someone under the age of 40 come in with a heart attack who is not a tobacco user.
Really?
So get rid of tobacco.
Well, no, I'm just curious because you were talking about chest pain being one of the symptoms or signs that you have heart disease. What are some of the other things? Yeah, that just in case someone's watching and they're like, oh, you know, I have that.
What should we be looking for symptoms?
Yeah, sure. One is if you are active and you start to notice that you're not able to do the things that you were previously able to do, you start to get a little bit more short of breath, you're a little more tired. That's definitely potential warning signs that something might be going on. Some people have strange symptoms, so we hear about the associated symptoms, and you always ask, oh, do you have arm pain or jaw pain? Generally, those are what are called referred, but if you have chest discomfort, it doesn't always have to be pain. It can be pressure. just a discomfort, a chest fullness. And if you get the left arm pain or left arm discomfort or pain that goes up into the jaw with that, especially if that happens with activity, then those are definitely big warning signs and they need to be evaluated.
Okay.
Absolutely. Now, we talked earlier just a little bit about this new graph or map that's out
The
that the CDC had released.
Yes, yes.
Let's talk about that, because that is insane. And I think if people are more aware of what we're doing, and maybe we can cut back just a little bit, you know,
I think
might help.
I think if anybody's interested, if you go to the CDC website, there's a series of maps that basically track the obesity trends in the United States, starting, I want to say, in the 1980s and then progressing up into the mid-2000 or 2006, 2007. And they use a different color to show when the average body mass index or average weight has gotten higher, and once we get into obesity and then super obesity. And the rapid rate where you see the states changing and the color map changing across the United States, it's really astounding. And these are things that are happening just within a couple decades. So I think everybody should check it out.
Yeah, truly an epidemic.
It's an epidemic.
Yeah.
It truly is.
All right. Well,
Choices.
thank you so much, Dr. Deneen, for being here. We appreciate it. And thank you to First Coast Cardiovascular Institute, of course, for sponsoring this segment. And remember, they say know your body, know your risk factors, work with your doctors to address them.
Indeed. And if you want more information about cardiovascular disease or First Coast Cardiovascular Institute, just visit their website at firstcoastcardio.com or call 904-493-3333.
And Dr. Deneen, thank you so much again for being here. We appreciate it.